To welcome Dr. Glen from the University of Manchester. Sorry, I'm just trying to radio. So Glen is a senior lecturer in health data science at Manchester. He has an interest in developing and implementing prediction models and has particular research interested in missing data. And so today he's going to tell us all about missing data and prediction models. So without further ado, I'll hand over to you, Glen. Thank you.
Thanks, Becky, and great to see so many in the room and online. I'll try not to disappoint and give some practical tips of how to deal with missing data in prediction modelling. So you're all very busy people, and so I've structured the talk to try and give sort of practical tips and recommendations, signposting to literature as we go along. You can hopefully all take something away from, irrespective of your level of experience with missing data. So I'll try and do three things over the next 40 minutes or so. So the first is motivate why missing data matters for prediction modelling and why it's perhaps not solved in comparison to other types of study. Second, I'll introduce what I call the compatibility principle of handling missing data in prediction modelling. Some practical recommendations for both developing and then validating prediction models. So just to get the ball rolling, I just want to be really clear about what I mean by missing data. So throughout the talk, I'm going to assume that what we're interested in doing is using a set of predictor variables to predict the risk, an individual's risk of some future. And I'm agnostic to the type of model that we might use to make that prediction, be that a regression model or a machine learning model. But for the context of missing data, what I specifically mean is that some individuals have unknown values for certain of those X terms or the predictor terms. Okay, so I'm not necessarily interested in missing outcomes, although we can talk about that at the end if anyone's interested, nor the related topic of sort of loss to follow-up and missingness that induces. I'll touch a little bit around the end of the talk on systematically missing predictors. So if a predictor is included in a risk model, but then in your particular data set, it's not collected at all, I'll touch a little bit on that towards the end. Okay, so the reason that I'm particularly interested in this topic, and I guess why there's quite a few people here today, is that missing data presents challenges to us at every single stage of the prediction pipeline. So for model development or model updating, into that situation where some of the predictor variables are missing, then we have a challenge of how we're going to handle those missing values in order to allow us to estimate say model coefficients or the parameters of a machine learning algorithm. Most, if not nearly all, regression models and machine learning models require us to process that missing data before actually fitting the model. Very few techniques have ingrained abilities to do this, albeit some do. And so we need to deal with that missing data prior to actually fitting our model, otherwise we get into trouble. At model validation, we then might be asking ourselves, we have an existing model and I want to validate that model in a new data set, but perhaps some or all of those predictors have missing data from that existing model. And so the question then becomes, well, how do I apply that existing model to make predictions for an individual's risk in order that I can compare those with the observed outcomes? And then finally, if you get that to the stage of implementation, where you've embedded a prediction model into practice.
Because I know exactly how to deal with this problem tonight.
And there, what we may be faced with is a situation where a clinician has a patient in front of them where they know some of the predictor information about that person. And then the question then becomes, do I allow us to use that model in the presence of that missing data, so partially informed prediction, or do I restrict myself to a situation where I need to observe all of that predictor information about that patient before I can use the model on them? And each of those stages present us with slightly different considerations. And the reason I'm presenting it like this is that this thread of these questions throughout each stage, I'll thread that through the entirety of the talk, particularly in the latter stages. So some of you might be wondering, well, isn't all of this well established? So there's a whole host of literature that talks about the use of multiple implementation in medical research when we have missingness. So for people that perhaps are unfamiliar with this technique, the synopsis is that for any predictor where there's missing data, we fit a series of imputation models, as they're called, which try to estimate what those missing values are, conditional on all of the other covariates in our data set and the outcome. And by fitting those imputation models, what we do is we fill in the blanks effectively. And we do that lots of times, say 20 times. So 5 is illustrated on this picture, but 20 would be common. So we fill in those blanks using those imputation models and create 20 complete data sets, for instance. And then we would run our analyses in each of those imputed data sets individually before then pooling the results at the very end to create our final analysis. So this method has been well researched, and indeed it's widely recommended in health research because it is a very robust way of correctly estimating parameter estimates. So for instance, if our study is interested in saying what's the effect of a particular drug on outcome, then multi-mutation will, if the assumption is followed, give you an unbiased estimate of that causal effect. It also correctly estimates the standard error associated with those estimates. So through this process of creating multiple copies, we're respecting the fact that there's error associated with the estimation process itself, but then also error associated with the fact that some values were originally missing. And this is being widely known. So the question then is, well, why can't we just immediately apply those techniques through to prediction context? And I'm going to present a series of reasons why I believe why I believe it can't. The first of which is that I mentioned multiple imputation is shown to estimate unbiased parameter estimates. But in prediction modeling, we're not necessarily interested in recovering unbiased estimates of our parameters. And in fact, by biasing our parameter estimates, so the coefficients of a regression model, for instance, we might actually improve our out-of-sample prediction compared with maximum likelihood estimates. So this is sometimes referred to as Stein's paradox, which is what the paper on the left is. So to put that into some context of what I mean, it's widely recognized that techniques like lasso and ridge, so penalized likelihood techniques, can improve our prediction process by minimizing overfitting. And that process, what lasso and ridge are doing, is they're inducing bias into our coefficients. And so that is an illustration, I think, that in a prediction context, we may not want bias estimates. The second challenge is that of the assumptions that multiple imputation is making, and whether this applies to the type of data that we use in prediction modeling commonly. So classically, the research that's looked at missingness has followed a very classic type of study where you're following people up through time and you have a very structured observation process about those people, where people are coming in to the hospital or a clinic and being observed at the same points in time through a prospective cohort study, for instance. In contrast, a lot of the prediction modeling work is done in routinely collected data, where that concept of a observation pattern doesn't exist. We interact with healthcare when we need healthcare or when somebody suspects something's wrong with us. So a nice illustration of this so-called informative observation is this paper that I'm citing on the right, which was interested in looking at the prediction of mortality on intensive care units. And the authors found that the ordering of a particular lab test on ICU was more predictive of outcome than the actual result of that lab test itself. And at first that might seem a little bit counterintuitive, but I think the intuition behind this is that the fact that a lab test has been ordered is capturing the latent process of clinical judgment. Okay, so the fact that the clinician has said, Glen Martin needs this particular lab test, is capturing that nuance and expertise that the clinician is having. Okay, and this happens all across health data that we frequently use for prediction modeling. Another classic example of this is that you only go to see your GP when you think something's wrong. You don't go for a day out. And so this sort of leads into concepts that the missingness or the observation process is not at random, okay, which is one of the crucial assumptions that multiple imputation is making. The final challenge that I'll touch on is a more practical one. So the way in which multiple imputation works is that you have to include the outcome in your imputation model for all of the other predictors. And there's a whole heap of theory that I won't touch on that covers that. This paper at the top by Lucy is a fantastic example of illustrating that, why that is. But if we just take that as read and say that we need our outcome in the imputation models, if we pause and think that through for a little bit, that's fine at the development stage, but less so further on in the prediction modeling pipeline. So when I come to deploy my model, for instance, I don't know what the outcome is. If I did, I wouldn't need to be making a prediction. And so that leads to a little bit of a disconnect between the model that we're using to develop our model, in terms of the imputation model I mean by that, and then the model that we're ultimately then use in practice. The other is very practical in terms of ingraining prediction models into IT systems is notoriously hard. And so if you then couple that with quite a computationally demanding multiple imputation procedure, that adds a little bit of strain as well. Okay, and again, this paper at the bottom is a good example of talking through how you might do that for an individual patient. Effectively, the process is to stack the new patient on top of the original development data set and then apply the imputation models. But that obviously requires access to the original data, which you might not always have from an IG perspective. And so hopefully what that is illustrating is that missing data should be perhaps handled a little bit differently for prediction than it has been for other types of studies, so description or causal explanation, where, as I say, multiple imputation is the gold standard. And we touch on some of those topics in more detail in that paper. But irrespective, that leads to then opening up the door for a whole plethora of other techniques that we might use to handle the missingness. So this is a non-exhaustive list, and certainly some of them I'm not recommending, but it's a list of approaches that are used in practice, as I'll come on to in just a couple of slides. So we have very basic things from complete case analysis, where you just delete everybody that has a missing predictor, all the way through to techniques that actually build in the imputation process as part of the model fitting. Bayesian, fitting the model under a Bayesian paradigm is a classic way of thinking about that. Again, I'll touch on that a bit later. So given that we have now access to a range of imputation methods, what we were particularly interested in a few years ago is what methods are used at each of those stages across the planet. So this was work led by a PhD student at the time, Antonia, and she was effectively conducting this review into looking at specifically what missing data handling methods are used at development, validation, and implementation. And what she did was identify models that are recommended in NICE, clinical guidelines effectively in the UK, which mentioned some element of prediction modeling topic. And we also reached out to various other authors and groups for any others that aren't picked up by NICE. And then once we'd found those 36 models, we then traced back to find the original development and validation papers of those prediction models that have been recommended by Knights, and the screenshot of those models is on the right hand side. And from each stage, as I say, what we're interested in is what the handling of missing data was at the time. And this is the Sankey diagram of the findings. So we've got the stages of development, validation, and implementation on the x-axis, and then the colours are effectively the proportion of papers that are doing each of the different types of missingness. And I think there's a couple of conclusions that we can draw from this. First and foremost is that reporting of the handling of missing data is poor, to say the least. Quite a few of the papers, if not the vast majority, just simply didn't comment on what they did. Okay, and so one would then naturally draw the conclusion that they're not handling it. So perhaps doing a complete case analysis. Okay. And this has been shown in other studies as well. So this paper here picked out that the quality of reporting in machine learning-based predictive model studies with regards to missing data was generally poor. This makes the judgment of the validity of the reported prediction model or their predictive accuracy difficult or even impossible. And I think that's quite a nice quote to capture that. So even if you disagree with anything else that I say today, I think there's certainly vast room for improvement in terms of the reporting of actually what you're doing when you're developing these models, irrespective of what that technique is. And of course, tripod guidelines are the way to do that. The second conclusion, perhaps more specific to my talk here, is that there's a lot of inconsistency in the methods that are being used across the different stages. So, for example, if you just track the red bars of the Sankey diagram, you can see that a not insignificant proportion of papers are using multiple imputation development and then validation. But then by the time they come to implement the model, they're just imputing those missing values using a mean. Okay, and that might seem a little bit strange at first, but I think that links back to the practical considerations that I was alluding to a few slides ago. And so the question we asked ourselves was, well, does that heterogeneity in the handling make any difference? Does it matter that you're developing a model using multiple imputation and then deploying it under a mean imputation strategy? And that question leads to the second part of the talk. So I'm going to take a step back to introduce this idea of compacity principle. I'm just going to take a step back from missing data for just one slide, because I think there's a broader issue at play here. So I think in prediction modeling, we've got to think more about what the end game is in all of our decisions. So I'm a big Avengers fan. This, for anyone that doesn't know, is one of the characters in that series, Doctor Strange. And Doctor Strange is able to see possible future outcomes. What he does is he chooses actions now in order to reach that final end state. And then if he acts in a way that contradicts that future that he needs, then the plan will fail. And the reason that I'm putting this in is that I think we can take a lot of lessons from that analogy for prediction modeling decisions in general, including missing data, but outside of it. So all too often, the implementation of a prediction model is treated as an afterthought. People develop a model, they validate it, and then after the fact think, oh, wouldn't it be great if we were then able to implement that model into practice? And they try and sort of wedge a square peg in a round hole to try and engineer that to be true. And I think there's a lot of advantages in actually flipping that on its head and saying, my starting point is that I want to implement a model. What can I do now in terms of analytical decisions at development in order to reach that final future state of getting the model into practice? And by doing that, you're engineering the model for success from the very outset. So an example of this is if we're wanting to implement a model into a hospital's EHR system, and we develop a really complex, computation-intensive machine learning model, is the IT in that hospital going to support that model? Does it have the computational power it needs to run that model to make predictions for a new patient. If it doesn't, then it's pointless using that complex model. And we need to reverse our engineer our actions. And I believe the same is true for missing data. So the way in which we handle missingness now at development should in part be informed by how we eventually want to handle it at the point of actually deploying our model in practice. So the current landscape, prior to the paper I'll talk about, was showing that there's certainly this benefit of handling missing predictive variables during validation and development that align with the deployment strategy. So these are just two papers that I'm citing to show that talk about this idea of sort of aligning the two principles. What was currently missing was exactly how that intended deployment strategy should inform it. So in other words, which missing data handling methods at development and validation are compatible with or align with however we want to handle it in implementation stage. And to come up with that concept, what we have done is defined two principles, which is what I'm coining the compatibility principle. The first is that the way that we handle missing data during model development should minimize model degradation when deploying the model under a certain missingness handling strategy. So again, people aren't familiar with the term model degradation. That effectively just means a drop in performance. You can think of it loosely that way. The second principle I'm going to introduce is that the method that we use to handle missing predictors during validation should provide an unbiased estimate of that model's predicted performance when you then deploy it. Okay, so if I do a validation study and I estimate an AUC of 0.7, is that an unbiased estimate of that AUC in the deployment setting? And for any missing data handling method that achieves both of those two things, I define that as being compatible across the life cycle. So this paper is pre-printed, currently under review with Stats and Medicine, looked at trying to identify which combinations of missing data handler methods achieve those two principles on the prior slide. And the way we did that was through both a simulation study and an empirical study. For the interests of time and broad audience, I'm not going to talk about the simulation study in too much detail. Read the paper if you're interested, I guess. But what I will talk about is the empirical study. So there we used data from the Northwest Clinical Outcomes Research Registry, or NCOR, which includes patients who undergo lung resection in either Manchester or Liverpool NHS Trust. And what we did is we extracted patients who underwent lung resection between 2012 and 2018, and that contains a whole heap of characteristics and information about them, ranging from pre-op all the way through to post-op. And within the context of lung resection, there's generally interest in developing models that predict mortality shortly after the surgery. So 90 days is common in order to inform treatment strategies in this context. And so in the paper, what we did is we draw on an existing model called RESET-90 that was developed using these exact same data for predicting individual risk of 90-day mortality post-surgery. And so to answer this question of which imputation methods are compatible, the process that we followed is as such. So we started by bootstrap resampling that data set to create 100 development data sets. Within each, we applied various different imputation methods, so complete case, regression imputation, multiple imputation, and mean imputation. And within each of them, we refit that RESET-90 model. We then applied every prediction model back on the original data set, imputed under all of those various different permutations I've just mentioned, and upon which we measured the usual suspects of predicted performance. And we needed to make some definition of what we call deployment performance, or what our estimate of deployment performance was. And for the purposes of this study, we took that to be the validation results that corresponded to the intended deployment strategy. So to give an example of that, if we were looking at a situation where you intend to deploy under multiple imputation, then the validation results corresponding to multiple imputation will take as being the deployment performance, which is obviously what we're targeting to estimate. These are the deployment scenarios that we considered, so all the way through from requiring fully observed data, which we could only consider in the simulation study for obvious reasons, and the rest were various different ways of handling missingness at the point of deploying the model. So this is a classic table 1 of the data. So we had 6,600 participants, an outcome prevalence of about 3%. And you can see from the table that missingness ranged from 0 through to around 20% across those different variables. It's quite a spread of missingness, and quite a high proportion of missingness if you consider all of the rows combined. So if you do a complete case analysis of that, it's dropped quite significantly. So this plot requires a little bit of digesting. There's quite a lot going on. So let me just talk through it. So on the y-axis here, we've got the imputation method that was used during the validation phase. So some model, effectively where you create a model for every single pattern of covariates, all the way through to multiple imputation. Regression imputation is RI on the y-axis, mean or mode imputation, and complete case analysis being CCA, abbreviated on the y-axis. The columns of the plot are the way in which missingness was handled when we were developing the model. Again, so you've got the same combination of strategies spanning the top, and then each column is the performance of that model validated under the y-axis technique. The rows of the plot are then each of those deployment strategies that I just talked about in the previous slide. The x-axis is then the difference between the validation performance and predicted performance that you estimate and that would be observed in the deployment setting. And obviously we want that to be 0 for an unbiased estimate of predicted performance. So there's a lot going on, but I think the takeaway is that commonly used methods that are used in practice, so for instance, doing multiple imputation at development, which would be this column here, then using multiple imputation at validation, which would be on the y-axis, leads to biased estimates of the calibration slope in particular. So that would be the top row of plots. And these are things that are happening in practice. So that combination, you get an estimate of predicted performance that is totally unreflective of then what the performance of that model is in practice. So that's the first takeaway. The second takeaway for me is that level of bias mattered more, or depended primarily on how the missingness was handled during validation, irrespective of how the model was originally developed. So you can see that the level of bias is pretty consistent across the columns of this plot. And so this leads me to this concept of, okay, well, for me, this is indicating that we need to be considering how we're deploying the model, making earlier considerations, such that the multiple stages align, okay, so that we're getting an unbiased estimate of our performance when it's actually deployed. And so that leads into the final section of the talk with where does that leave us in terms of what should we actually do? And the way I'm going to talk through this is to split this up in terms of strategies for handling missing data at model development stage, and then I'll move on to validation. Looking first at the development stage, and specifically differentiating this idea of deploying a model in practice where you allow missing data and a strategy where you deploy the model in practice, where you require everything to be observed before you allow clinicians to make a prediction using the model. Okay. So we take the latter case first, so deploying a CPM where no missing data will be allowed in practice. The results of our papers and a few others are saying that in that case, use multiple imputation to develop your model. As I've said, you need to include the outcome in the imputation models for that. And if you think about that for just a second, I don't think that's too controversial as a statement. Multiple imputation is designed to recover unbiased estimates if missing data hadn't been an issue in the first place. And so if your future goal is a situation where missingness won't happen, deploying the CPM without missing data, then I think it's natural then to use multiple imputation to develop more following that step. Having said that, the use of MII still presents some analytical steps. And so there are these two papers on the bottom that are covering techniques of how to ingrain MI into all of the analysis process. So variable selection, if you've got 20 imputed data sets and you're doing variable selection in each one, how do you then choose what the final set of predictors is? And the paper on the left at that. And similarly, this idea of bootstrap internal validation. We've now got bootstrapping and MI going on. What order do you do those things? These are two issues that people commonly come up against when I say use multiple imputation. And so I'm just signposting to the two papers that have provided recommendations for that if anyone's interested. Okay, so that's the first case. If you're developing a model and you're deploying it under all data, use multiple imputation. The slightly more interesting setting is if you're developing a model where your future end game, if you like, is that missingness will be allowed. And so you need some way of handling missing data at an individual level when you deploy it. If I was to make one general statement, it would be that we should use the same approach that will be used in that deployment setting. So if you plan to use regression imputation when you're deploying the model, then use that regression imputation when you're developing it as well. There are obviously some caveats to that. Okay, we shouldn't be using methods that in deployment or development that are just fundamentally flawed. Okay, that's not what I'm saying. What I'm saying, if you're having to choose between valid imputation methods at development, base that decision on how you intend to use those valid imputation methods in deployment setting. So some particularly appealing methods are this pattern submodel, where, as I say, you effectively fit several prediction models, one with each combination of covariates that might be present. So if you've got age and sex, for instance, you would effectively fit 4 models, one with just age, one with just gender, one with both, and then one with neither. And the idea is that you then use the model that corresponds to the covariates that you've observed for the patient you're trying to make a prediction on. So if somebody comes in and says, I know their gender, but I don't know their age, then you would use that corresponding just gender-only model in the example I've just given. Random forest imputation is also particularly appealing. So that's very similar to regression imputation, except that it's using a random forest, obviously. And then finally, using Bayesian approach is, I think, a particularly natural way of dealing with missingness, where effectively the missingness is treated as an unknown parameter, and you just sample a stereo distribution over that unknown parameter space. Okay, so you're not imputing per se, you're ingraining the missingness handling approach directly within the model. Okay, I'd say as an ideal, but I appreciate Bayesian approaches are quite rare in prediction modeling. Just to emphasize, what we shouldn't be doing is complete case analysis. We're just throwing away data unnecessarily. There's no reason whatsoever to do complete case analysis. Commonly cited approaches are that it's easy, or it's computationally feasible, or that missingness is at random, so imputing it isn't valid. And I would say that, in general, there are always better approaches of doing that. You're just throwing away data unnecessarily. And similarly with mean imputation. Okay, that's very related. And you're just imputing everybody with missing age with the mean value of age. Again, there's easier or better ways of doing that are embedded in statistical software. Related to this idea of what to do at development, I want to just consider some wider implications of handling missing data at the development stage. The first of which is linking back to that ICU example I gave at the start of the talk about informative observation. So if you're in this process of modeling where the very presence of somebody's data is predictive of outcome, then there are a range of techniques that you can use to look at that. And this is a review paper that about PhD students from a few years ago, Rose led, reviewing methods that model observation patterns. They generally fall into one of two buckets, one being you joint model between the repeated measurement process of people coming in and recurrent events, or the observation process, and the second bucket being marked point process type models. And again, just signposting to that paper for anyone that's interested in that element of missingness that I don't have time to cover in detail. The other implication is on sample size. So if you've done a sample size calculation that assumes that you're going to have 100% fully observed data, then some work that we're currently doing is showing that actually you need to account for missing data as part of the sample size process. And Richard's general framework in terms of simulation is quite a natural way of dealing with that. So it's a bit of a plug, but watch this space for this paper coming in. But just to point out at this stage that it can be quite considerable. So in some scenarios, you need twice as much data compared with methods that assume complete data when making the sample size calculation. Okay, so that's development. For validation, I think it can be useful to distinguish between two things. So the first is ideal model performance. And this is where you're trying to estimate the performance of the model where all data is required versus pragmatic performance, as this paper calls it, which is the performance in a future setting where some individuals have missing data. This is another way of representing what I've just been saying so far. Okay, so if we have those two definitions in mind, what do we do? So the first thing to say is that I think we need to start treating the imputation model and the prediction model as a single unit. Okay, so if I develop a prediction model using a particular imputation technique, I should package all of that up to allow other people to use both the imputation model and the prediction model in their data. Okay. What commonly happens is people will report prediction model and people need to re-estimate imputation techniques at later stages. Again, this is heard by Hoogland, which is particularly nice in this context, and they quote that both the prediction model of interest and the requirements and method of handling missing data from future individuals can be considered as a unit. And they touch on several techniques, imputation techniques, that allow people to do that transportation and reporting quite naturally. I think then that obviously links in with tripod a little bit in terms of being really explicit about not just the model coefficients, but then also any algorithms and imputation models that are used to impute it, and perhaps considering tripod in the context of actually reporting imputation models is equally valid. After all, when you're imputing data, you're effectively predicting. Two are synonymous. So what do we do then? So with those in mind, again, if we're allowing the model to be deployed where missingness will not be allowed, I should say, on the top section. So in other words, if we're trying to estimate this idea of ideal model performance, then again, I recommend using imputation for the same reasons that I described earlier. If you're in the other situation where missingness will be allowed in practice, then we need to think about how you're going to do that and use techniques that allow you to make predictions to individual patients. Okay? If a clinician has an individual patient in front of them, I need to use techniques, and I don't need to be wanting to stack their data with everybody else's. I want to be able to apply the imputation model directly to that individual to allow me to make a prediction. Again, this is a range of methods that are particularly appealing to that context. So just a couple more slides before I wrap up. So the first is a quick note on this idea of systematically missing predictors. So this is in the situation where there's an existing model that's been published, you're wanting to externally validate that model, but the data set you have access to doesn't collect or observe one of the predictors of that. So it's systematically missing for every patient in your data set. What do you do in that situation? One strategy is to combine the prior development data set together with your validation data set and apply multiple imputation in a clustered or a hierarchical style, effectively add a random effect into the imputation models clustered at data set level. That's what this paper screenshotting suggests to do. That would be great if that were possible, but obviously, usually we don't have access to the original development data. And so what do you do in that situation? Well, one option is that you just set all of the risk factors to be absent for that missing data, or you can impute it under some known distribution. So if you can obtain the mean and standard deviation of that parameter from the prior paper, then you can just impute under a normal distribution with those factors, for instance. Okay, not ideal, but it is one strategy. In practice, it's probably a mixture of the two, so you probably need to report your validations studies under the different approaches and explore sensitivity of them. So this slide's just summarizing the last 10 minutes of what I've been saying, just on a single slide. Effectively, I think the overarching statement is just use the same imputation technique as you're going to use it at the end of the day. It's the overarching conclusion. I've been saying that quite a lot, deliberately so, because I think it's important. But then that leads to the question, well, how do I decide how to handle missing data when I'm implementing the model? I think there's a range of things we should consider. So the first is obviously the expected missingness mechanism. Can't believe I've got through a missing data talk without only just introducing these concepts of missing at random and so forth. But consider them, right? And one way in which you can do that is to produce graphical representations of missingness. So effectively, you can create a DAG in collaboration with end users of what you think the observation process is, and then from there you can draw the analogy with whether it's MCAR or so forth. Second is the intended clinical use. So allowing missingness during the implementation phase is certainly broader. It opens up the door to use the prediction modeling more common, because you don't have to observe everything. But it increases uncertainty because we don't know some information. And so what I'd suggest is that you need to consider whether that matters, whether that widening of the prediction interval matters for the intended use case, and that will be domain specific. The third links to what I was saying earlier around sort of workflow integration considerations. At the point in the clinical pathway when you want to use the model, would we expect all data to be available or not? And then finally, IT system and computational reasons. With that, I'll summarize. So to take one thing away from what I've said, I think it would be that the choice of how you're handling this data at deployment does have ramifications for earlier on in the pipeline. And I think this is a commonly overlooked issue certainly in the applied literature. I expect that missing data can have wider implications to other choices, but that shouldn't force us to shy away from using these techniques. So if you want to use a multiple imputation, but you're concerned about variable selection, then I've cited some papers that you like to do. And with that, I thank you all very much for your attention.
Thank you, Glenn. I have such a great talk. I think that's probably going to be really helpful for lots of people who are planning to develop models in the future. As I'm sure most people are probably not thinking about how they're going to be using this in data implementation when you first develop the model. So I saw we had a question on the chat. See if I can see the chat on here. So Arthur, if you'd like to unmute yourself, please feel free. Otherwise, we can ask the question in the room for you. So Arthur has asked, would you recommend regression imputation when there is only one variable with missing data?
Short answer to that is yes. And in fact, actually, regression imputation was originally developed for that situation. So you can actually use many of the multiple imputation packages to apply regression imputation, single regression imputation in that setting. So in mice, for instance, if you just set the number of imputations to 1, then that exact process just works using that software. In terms of your second point, so submodels is interesting, but impractical when there are multiple variables in a large data set. That is 100% true. And that is indeed the shortcoming of that particular approach. I think related to that is that there is a little bit of concern as the variables grow. You start to get small cell counts, if you like, thinking of that situation for particular combinations of covariates. And so the level of overfitting for that particular submodel would be a particular concern. So I think there's more research to be done around that for sure.
You have another question on there from Daniel. So could the sweep operator be an alternative to obtain the submodels as long as the coefficients and the variance and covariance matrix are provided?
Yes, again, short answer is yes. So this is a method where, for anyone that's not familiar with that, is that you fit the full model, or you report the full model alongside the covariance matrix, and you can effectively use the covariance matrix to estimate what all the different submodel coefficients would be, and that is particularly appealing. However, people reporting covariance matrices into papers is rare.
Do we have any other questions online or in the room? Gary?
Great talk, Glen. Can you say something around more broadly as to whether we should allow, research should allow missing data implementation? I'm probably of the mindset that in most instances we shouldn't be letting people implement models with missing data. You mentioned age. Now, age was just an example, but age often is quite a dominant predictor. So you wouldn't want to implement a model that you don't have information on the really dominant predictors.
Yeah, I totally agree with that. I think in general, I think if I was doing this, I would say you need to deploy it under a strategy where you're going to force people to observe everything. I think not doing that just opens up the door for all of that uncertainty. Perhaps there are situations where that level of uncertainty isn't going to impact the decision making. Perhaps, for just audit and benchmarking. And so perhaps there could be a case where you allow missing in that strategy. But I think in general, get things observed.
I'm glad on the same wavelength.
So we have a question from Diane from King's College. So yes, thank you for a great talk. So many models use electronic health record data and have been collected as needed and hence miss and not at random. So what are the practical implications? That's the first question.
Yeah, that's a really good point. So I think this links to that informative observation angle that I was talking about. So I think some practical implications are that most of the imputation methods work under an MAR assumption. Okay, now that's not to say that they all fail when it's MNAR, but it is to say that you need to start considering the implications of that as needed observation process. And in some situations, like the ICU example I give, you need you need to incorporate that because the observation process is predictive. And so if you're ignoring that, then you're sort of conflating two issues. And so modeling the observation process jointly with the outcome process, I think is one way of doing that. Caveated that it's obviously data intensive.
Thank you. Yeah, so question 2 from Diane is, you mentioned that missingness indicator can be handy for prediction. Could that overfit the reporting or data collection instead of helping?
Yeah. Yes, is the short answer. So if you report a model that says the presence of a particular variable is predicted, then it does open the doors to sort of engineering that observation process. I think my counter to that would be that then you can start updating the model, and actually if it's forcing people to collect certain things because they're predictive, then that should be a good thing. But as long as you update the model, I think it should be.
So a question from Becky Gordon. In a scenario where only complete cases will be considered upon deployment, when would multiple invitation not be the recommended technique at development or validation?
That is a good question, Becky. I can't think of a scenario where it wouldn't be recommended, other than if there were concerns around then how you would use that for a single individual at the deployment setting. But again, then it's complete cases. No, I can't think that there wouldn't be a scenario where you wouldn't do that. That's not to say that you have to use multiple invitation, but I think that would be my recommendation for doing so, because it's quite a natural way of handling missingness at that stage, because you're effectively then treating the missingness as a nuisance.
Yeah, and we've also got comments asking if you will be sharing the slides. Are you happy to share? If you're happy to share slides, then if anyone who would like the slides, you could email myself and then I can share them on with people. John?
I was just thinking about the setup where, when you're developing a model and you produce a framework which everybody is then collecting the data, because you've told them that's the model, you need to have these data, that your measurement, your missingness is probably going to go down than when you actually generate the study originally. And actually people don't know what it is. There's some data there, some data's not. You're using routine data, it's all over the place. How would you match that up with, because that's quite a change between the missing data in that development thing to when actually it's been sort of trained. So you must do this, people will behave better.
Yeah, I think that's a really good point. And I think that's then where sort of prospective validations can help, because then you can start to see what the impact of that sort of improvement in the observation pattern or change in the observation pattern is having on modelling and so the predictive performance of that. So I think if you start with a situation where a particular test isn't recorded because it's hard to do, but then the model says actually that's really predictive if you do it, then as you say, you might be more inclined to certainly record it in the data set. It's about that validation and updating how they
Following on from that, Glenn, do you have any advice for statisticians in general about how to understand what is actually available to people at the front end? So how am I supposed to know what the clinicians have got at the front end? And how can I bridge that gap to understand what things are missing in real life when I don't work in that system?
That's a good question. I think I don't have all the answers for that. I think that's where multidisciplinary teams come into this. So I think as statisticians, we need to be working with end users of the model to sort of elicit that information. How you have that conversation in a meaningful way, I think is something that.
We've got another question from Arthur, who said, I'm not aware of a model that has been deployed using Bayesian joint invitation. Are you and would one implement such a model?
I'm not aware of that. So you would implement it by so you'd have to report the distributions and provide some way of sampling from the posterior if you were deploying it under a situation where you're allowing missingness. That isn't an issue if you're in the other situation. But if you're in a situation where you're allowing missingness when making a prediction, you would have to allow somebody to draw from those posterior samples in order to do that. Which again opens up a whole can of worms about how you do that. Which is probably why nobody's done it.
Do you have any other questions in the room? No. Follow up from Arthur. In this case, should one include the outcome in the imputation model?
Or Bayesian approach, I assume that means. So there isn't an imputation model in that setting. You just fit the entire outcome model, but the missingness is treated as a parameter that you put a prior on and just estimate in the same way as you would a prediction. So there isn't necessarily that separation between the imputation model and the outcome model, if that's what you mean.
Any final questions before we wrap up? No? Okay. So just before we finish, we have our next TAP seminar, which is on the 14th of April. And we'll have Dr. Laura Bonnet from the University of Liverpool. She'll be talking to us about evaluating prediction models with recurrent events. So for anyone on the mailing list, I will be sending out an invite shortly, but for anyone who would like to join and isn't on the mailing list, then please just send me a message and I can share that with you as well. So yeah, before we finish, please can we thank Glen again, such a great talk. Thanks.